Well, the number of fentanyl-related deaths set records 2 years in a row here in Indiana, but our hospitals are not required to test for the drug in emergency rooms during a suspected overdose. In fact, California is now the first and only state to make it mandatory. Our Samantha Johnson sat down with some of Indiana's top doctors to figure out what here is different.
Emergency rooms are already regulated to test for 5 other drugs. So our question was, what's one more? Especially when you learn the fentanyl test, according to doctors in California, only cost the hospital 75 cents. So here's what I found out. I talked to the chief of the emergency department for Eskenazi Health. He says requiring a fentanyl test for every suspected overdose really does nothing for the patient once that drug is already in their system.
Does it change our outlook when it comes to emergency department care, especially trying to get people access to long-term treatment? No, it doesn't at all.
And here's why. So Dr. Stepsis says when it comes to opioids, they typically present similarly in patients. Those people usually aren't breathing well. They may have small pupils, or he says they may have little to no response to pain. So Dr. Stepsis says his team rarely, if ever, needs a drug test to diagnose what's going on. He says the focus for each overdose patient will always be treatment and long-term care, regardless of the drugs they've taken.
So it's really, mandating, if you're going to mandate anything, mandate that people get the appropriate resources they need to access care.
Now, I also talked to a medical toxicologist at IU Health. He agreed, saying physicians should be able to make the call about testing to best serve that individual patient without costing them more money. And that's important because even though we said it only cost the hospital 75 cents, it could cost us much more. So you can find more in-depth information about this story right now at WTHR.com, as well as some resources if you or a loved one are looking for help.
All right, thanks, Samantha.